of her tweets pinned, and so I'm absolutely sure she's been a regular contributor before, and I'm sure she'll be back here again.
I don't know anything about the various discussions, but all I can say is that I've been here many times saying exactly what I think.
Thank you. Thank you very much, and thank you, Catherine, for your question. I turn to Tom Clark at ITV.
Hello, Secretary of State. Thanks very much for taking my question. The first one, I think, is for you. My second question, if I may, for Professor Paris. Given the economic figures that came out today, which I think can only be described as dismal, wouldn't it be sensible to mandate the wearing of masks everywhere, not just on public transport? In fact, to do any measure that might help get the economy back on its feet that would help prevent the further spread of the virus. And to you, Professor Paris, the R number across the UK is still stubbornly near to 1. According to the scientific advice, that's largely to the amount of coronavirus in hospitals and care homes. I noticed, looking at the most recent Public Health England data for respiratory outbreaks in hospitals, we've had the largest increase in respiratory outbreaks since the peak in the last week. Does that show that whatever we're doing in hospitals to prevent coronavirus spreading is not working?
Thanks very much, Tom. So look, on the first point about, I should say, face coverings for public transport, not face masks, really important. I know that Peter's been working on this the last few weeks, and we're very, very keen. I'll ask him to say a word about that in a second. My understanding of the science, and I know that Stephen will put me right if I get this wrong, that in terms of sort of priority, social distancing is absolutely the most important thing, along with washing your hands and along with not touching your face. So perhaps those things are equal, Stephen will tell us. We found when we looked at the evidence on face coverings that it was distant to those things. In the end, as you know, and as I mentioned in my comments before, we've decided to bring those in and make them mandatory because it is something that actually helps your fellow commuter, your fellow traveller, and we thought that that was a good thing to do for society. By its very nature, if you're on a train or a plane or a ferry or a bus, you're in an enclosed area. That's not the case if you are out and about on the streets, and I think that may be the principal difference of this. I wonder if I can just use your point to ask Sir Peter to comment on the face masks coming in and the work that's going on there, and then I'll go to Stephen on your last point.
So thank you, Secretary of State. On face coverings, when we first were restarting the transport system, when people were first able to travel again, apart from essential workers, the government said then that face coverings were recommended when it might be likely that you would be close to other people. The reality of our transport systems, and particularly as the economy ramps up, is that there'll be more and more occasions at which you might be closer to people than you would care for. So it seems perfectly logical to me and all my colleagues as transport operators to mandate face coverings now, because as we get to Monday and the restart of non-essential retail and looking at more people going to work, it's much more likely that you'll see or be close to other people. So face coverings is a sensible thing to do, and we're expecting on Monday, because passengers are hugely sensible, for people to be wearing face coverings.
My understanding, thanks Peter, my understanding, it's an enclosed space, and I think that's the key difference between that and walking down the street. But I'm just going to let's go to the expert, both on that and the R number question, Stephen.
So on the face mask, as I think the Chief Medical Officer and Chief Scientific Advisor said a number of times on this podium, the evidence is weak, but nevertheless there is some evidence, and it is better for enclosed spaces than open spaces where there is less risk of transmission. On the question of hospitals and infection in hospitals, you're absolutely right. It is very important that we focus very hard on infection in hospitals. Clearly, the hospital environment is one where there is more infection because we have been treating many thousands of patients with infection, and clearly infection control and stopping any potential spread in those environments is critical. This is something that the NHS and hospitals are well used to. We've been managing infection control for many years. We've had great success in things like MRSA. If you go back 15 years ago, that was common to see people infected with MRSA in the blood in hospitals, and through rigorous infection control, that is very much all, the levels are much, much lower, almost eliminated. So we know how to do this. So as we've learnt more about this virus and how it spreads, for instance, the potential for asymptomatic individuals to spread, we've been working closer and closer with our hospitals and other healthcare settings to ensure that we have the policies, the processes in place to ensure that we minimise the risk of spread. So if I give you some of the examples of what's been put in place, so we have been increasing the amount of testing that we've been doing both of staff and patients. So quite a while ago now, we started testing all patients who were being admitted as emergencies into hospitals, not just those with symptoms of COVID, that would allow us to spot those people who were asymptomatic and make sure that they were cohorted or segregated appropriately from other patients. We started testing staff who were obviously symptomatic, and then we started testing staff who were asymptomatic. More recently, we have had a real focus on data collection and understanding those organisations who we need to support the most, and Ruth May, the Chief Nursing Officer, is leading on that work. And only today, after the Secretary of State's announcement last week, we have asked all hospitals and healthcare settings to introduce the routine wearing of surgical masks. And the reason for that is when you move out of the ward areas where PPE is worn into the corridors and spaces where sometimes it can be harder to manage social distancing, it's important that the use of face masks is there to further reduce the chance of transmission. So we have progressively, over the course of this epidemic, introduced more and more measures as we've learned more about this virus to really minimise the risk of transmission in hospital. But you're absolutely right, it's something we have to continue our focus on and ensure we control.
Tom, you want to come in very briefly?
Just quickly then, why do you think you've seen an increase in outbreaks in hospitals in the last week?
So I think as we are moving now from a community incidence, so community amount of infection that is reducing, what we will begin to see over time is more focus on individual outbreaks. And of course, that might not just be hospitals, there might be other settings. You will know from international reports that abattoirs and meat processing factories have been subject to outbreaks, possibly because in a cold environment, a very cold environment, the virus is more stable. So I think we are now moving from a period of time where we've had to focus on a high level of that surge of infection in the population through to managing more discrete outbreaks, which, as again you have heard at this podium, will mean more local interventions to manage that. And again, that is something that Public Health England, that local directors of public health and local government and the NHS is used to dealing with. In non-epidemic circumstances, from time to time, we do see outbreaks of infectious diseases, and we know how to manage them.
Tom, thank you very much. I think it's just worth mentioning and reminding people, Stephen, that from Monday people should take face coverings to hospital if they're going there for any reason at all. Thank you. Let's turn now to Ashish Joshi from Sky. Ashish.
Thank you very much. My first question is to you, Mr. Shapps. You were talking about the importance of the R rate. For the first time today, we've had a regional breakdown. So while nationally we're still at 1 or just below, in the southwest we've got a range of between 0.8 to 1.1, which takes us above that all-important number the Prime Minister has talked about so many times. Are we moving now towards the very real possibility of regional lockdowns?
Thank you. So my understanding, again, it'd be wise for me to turn to medical expertise, but on the R rate and the way that's been published today, the range, as you mentioned, is 0.7 to 0.9. Nationwide, and we're confident that from what we understand from SAGE that it's therefore less than 1. There's then a band in each area, across the country, but in each area, where there's a sort of high and a low estimate made based on a number of series of different modelling approaches taken by SAGE, and it so happens that one of them, as you rightly say, says it could be between 0.9 and 1.1, but it's an outlier of I think the central estimate. To answer your question directly, we are very interested, of course, to be able, the more data we can analyse, the more we can see where there are outbreaks. I noticed today we're at 193,000 plus tests done or sent out. So we've got a large number of tests being produced, and that gives us much better more informative data about where issues might bubble up in the future. So I wouldn't want to rule anything out, but I think probably that Southwest figure today isn't quite as maybe being reported. But again, I turn to the expertise of the professor.
Well, yes, thank you. And it's exactly as the Secretary of State has described. So SAGE, or its modelling group, SPI-M, takes data from a number of different academic groups who do modelling around the R number, and then it takes all those individual models, which are all slightly different, they're all using slightly different assumptions and different models, and then it produces a consensus. And when it produces that consensus, it essentially has a central most likely projection and then a range around it, which represents that you can never be completely confident on a single central projection, and there is a range, what we call a confidence limit, that you might be familiar with in statistics. As you said, SAGE for the first time today has published those regional R values. They do have central projections and ranges, and the important thing is that in all regions, the central projection within that range is below 1.
Thank you. Ashish, do you want to come back?
Can I
yes,
just...
I do,
sorry.
actually.
Can
I just ask, we've been speaking to local businesses and people in the Southwest region today. They're quite worried about it. So what would you say to them to allay their fears and concerns?
So I actually cut Stephen off. You were finishing the point as well.
Well,
and probably can answer that.
I was going to make a further point around that R, of course, is a very important way of looking at this, but there are other things that we look at. So you may also be aware that the Office for National Statistics has published again today the results from their surveillance study, where they randomly sample individuals in the population to directly look for how many people are testing positive for this virus. And that study has shown that over the last month or so, the last few weeks, we have seen a steady reduction in their projection of the number of infections in the community. And really that evidence also suggests that the R value is below 1, because it's only when the R value is below 1 that we would see that decrease in the number of infections. So R is really important, but there are other ways too of measuring how frequent the virus is in the population.
Yeah, and Ashes, I'd say, look, the message to somebody in the Southwest watching this, concerned that they've seen that at least one of the projection models suggests there's a range which could go above 1, is please stay alert, follow the advice, stay at home. That's the only, we now know that's the only way to defeat this thing in the short term, and it's doubly important to do so, but across the country as well. And I think not to be over-alarmed, because as Professor Stephen Powis has said, this was actually the top of the range, which had a number of others which showed it was still below 1, but please stay alert. Can I turn to Natasha Clark at The Sun?
Thanks very much. My first question is to you, Transport Secretary. Several airlines have said that the government hasn't spoken to them in any detail about plans for air bridges, which would allow people to travel to countries with low rates of infection without having to quarantine. Is the government currently in talks with individual current countries for air bridges or travel corridors which could make that travel easier? If so, how are those talks progressing, and have any countries declined to work with us so far? And to Stephen Powis, Chris Whitty said earlier this week there was a reasonable chance there will be a second wave of the virus this winter. What extra arrangements are the NHS and the government putting into place to prepare for this in our hospital and care homes, and for the effect of a potential second lockdown, given how poorly prepared we were the first time?
Natasha, thanks very much. I mean, as Transport Secretary, of course, I spend a lot of time speaking to the whole of the aviation sector, amongst many others, and including on issues to do with things like the quarantine, which is the basis of the reason why air bridges would be interesting at all. And first of all, just on the quarantine, I mean, I think most Brits understand that we've sacrificed a lot. We've stayed at home. We've been fighting this virus, getting the R number below 1. What we don't want to do is end up sort of essentially re-importing it, either by people coming here or Brits going abroad and coming back. So I think the idea of quarantine is the right thing to be doing, and I note that it has broad public support. But you're absolutely right. We've always said it would come in as a blanket thing initially, and that's what happened, and that we would look at whether it would be safe to, for example, open up what you call air bridges, might better be described as travel corridors, because of course you can get here by rail and by ferries as well. And that's something that we're actively working on. The first review of this takes place on the 29th of June, so I'm sorry to disappoint you about which countries we're speaking to and all the rest of it. We will need to wait. At the moment, it is a blanket situation, but we're of course talking to airlines who are part of the specialist working groups on this, and talking to airports, and indeed we'll talk to other countries about it. But the basic principle should be that we must make sure that we don't end up in a second wave situation, which rather leads into your second question. People would expect us not to do that and to take every precaution against it, and we will only open up air bridges where it is safe to do so, and there'll be more on that at the review period, which is the 29th of June. And on the second point about the second wave.
Yes, so hopefully we won't have that second wave, but of course we have to think about the possibility and prepare for it. I would take a bit of issue that the NHS was poorly prepared, because I think the NHS did an absolutely magnificent job, considering this was a virus that we didn't know about until January. Started coming to the UK in February and March, and then we saw that huge surge in March and April. And the NHS, in my view, responded magnificently in very rapidly changing the way it worked in order to ensure that we had the capacity both in our general beds but also in our ITU beds for the sickest patients to ensure that at no time was that capacity breached. And we always had the capacity in place for patients who needed it. And unfortunately, in other countries, in other settings, we saw that wasn't the case. So I think the NHS showed just how flexible it can be in a crisis. Now, it's clear that we have learned lessons from that. It's clearly that we, going forward, can take some of the learning from that in case we have a second phase. So, for instance, we worked very flexibly. Staff worked flexibly in ways that they may not have done previously, and that will be possible again going forward. The Nightingale hospitals were built in case we need them, and we're actively considering what we need to do with those going forward to ensure that if there is a second wave, we have capacity in place. And we're also looking at usage of beds, and for instance, in outpatients and other areas, much more video consultation, and much more remote consultation. So different ways of working, some of which we've wanted to do in the NHS, but we have done in an accelerated fashion. So we are thinking very hard about how we can get back to business, back to normal business in the NHS. That's really important, that we are able to do all the stuff we do normally, but at the same time make sure that, although we are working hard to make sure it doesn't happen, that if we do see an increase in coronavirus and perhaps in the winter, that we have the capacity in order to deal with that, as well as the normal business of the NHS.
Thanks, Stephen. Natasha, was there anything you wanted to come back on?
I just follow up with new Transport Secretary. What do you think would be the best measure, in your view, to replace the quarantine system with, if indeed, after this review, you decide that a different approach needs to be taken? Obviously, the Home Secretary's discussed testing airports, and obviously you've mentioned air bridges just now. What do you personally think might be the best replacement for it?
Well, as I've said before, and the Prime Minister said and the Home Secretary said, air bridges or travel corridors are certainly a potential way forward, and that can be supplemented by things like testing as well, although again you have to take the scientific advice on the validity of doing things like testing at ports, airports and other places. But there's, clearly there are countries that have lower levels of infection, but that may be because they've yet to go into this rather than that they've come out of it again. So we need to be very careful and cautious. We won't throw away the good work that's been done, but we'll have very sensible conversations, and this would certainly be limited in the first place. And I'm speaking with the airlines and aviation sector the whole time about this. Indeed, we issued actually fresh guidance just yesterday for aviation and for passengers. So it's an active conversation, and there'll be more on this before very long. Thank you very much, Natasha. I'm going to turn to Adam Payne from Business Insider. Adam.
Good afternoon, Secretary of State, and thank you very much. I have a question about businesses that are dealing with the impact of COVID-19. We learned today that the government no longer plans full checks on goods coming from the EU in January. Isn't this announcement an admission that UK businesses focused on COVID-19 are not ready to trade with the EU without a deal at the start of the year, despite the government saying it is prepared to do so? And isn't it also the case that this new plan only covers goods coming into the UK, meaning businesses that are already suffering because of COVID-19 face the prospect of another big economic challenge in January. And a question for Professor Powis, please. Good afternoon, Professor. There have been reports recently of concern within the pharmaceutical industry that the combined strain of COVID-19 and leaving the EU without sufficient trading arrangements could put the NHS in a position where it doesn't have enough medicine supplies. Is this a possibility, and if so, how concerned are you by it?
Thanks very much, Adam. Look, without wanting to get back into the whole Brexit debate, and we have now left the EU at the beginning of the year. We leave the transition period at the end of the year, and it's this government's judgment that the best possible thing we can do for business is provide it with absolute certainty that we will not be stretching out or extending the transition period in any way, shape or form. And that is absolutely the case. The transition period will end at the end of this year. Now, what 27 countries in the EU do on their side is their business. The EU is there to represent them. As an independent coastal nation, we're here to represent the interests of businesses and the population in the UK, and we'll make sure that we do that. And actually, I think by saying now that we'll have the border, what we'll be doing on the border, in other words, that we'll be sensible about the way that we introduce this, makes perfect sense. I sit on the Brexit Operations Committee, which looks at the COBRA committee that looks at these things all the time, and working on what happens with the hauliers and what happens with the transfer of documentation and all the rest of it. And we're absolutely confident that we'll have great systems in place. There's no reason not to. This country will have all the ability to do those things, but we'll do those things on our own terms. Clearly, COVID, as you point out, has been a massive disruption to business. We've seen what it's doing to the economy. That is why we need the certainty for business of knowing that we are leaving the transition period at the end of the year, and that's what we'll do, and everything else in terms of the borders will fall into place. I'll pass over to Stephen, but just before I do, I'm just going to comment on the medical supplies, because the medicine supplies, we see these stories all the time. It's partly my responsibility for things like the freight contracts to make sure that doesn't happen. We've been challenged probably more than anything else since the war in this country with regard to freight supply, goods supply, medicine supply. And it is the case that we have been able to pass that test and never have a shortage of medicines with everything that's been going on in the international demand through COVID. So I'm absolutely confident we'll be able to do the same through the end of the transition period. Stephen.
Yes, so thank you very much, Adam. So, of course, medicine supply is very critical for the NHS and for all our patients. And colleagues at Department of Health and Social Care keep a very close eye on all those supply chains, of course, with support from the NHS and particularly the chief pharmaceutical officers of the four nations and their teams. We did a lot of work on that in preparation for Brexit, and indeed COVID has meant that the teams have had to do even more work on medicines, and particular medicines that are used in critical care, for instance. So I think we have a very good understanding of those supply chains, and we're able to look ahead and see where problems might arise and deal with them. And I should say that disruption to medicine supply is something that happens all the time for a whole host of reasons. There may be problems in manufacturing plants around the world, for example. There might be regulatory actions. And as the Secretary of State has said, we are very good at dealing with those, seeing them, seeing where they happen, and putting in place alternative arrangements. So we do know how to do this, but you're absolutely right. It's something that is critical to keep a very close eye on.
Thanks very much, Stephen. Thank you, Adam. And I'll turn now to Gemma Mitchell at Nursing Times.
Hi, thanks for having me. The coronavirus pandemic has intensified already existing racial inequalities in nursing. What solid and measurable action is being taken to ensure the NHS and social care system is a safe and supportive place for all our nurses, but particularly those from ethnic minority backgrounds? And secondly, we've heard concerns that student nurses who answered the government's call to join the frontline in response to COVID-19 are being asked to carry out duties beyond their level of competence. Is this acceptable, and what structures have been put in place to ensure students who have opted in are fully protected and supported?
Thank you very much, Gemma. We'll look on the first question about making it safe for people to work in what are sometimes by their very nature higher risks areas of public service, sometimes like medicine. We take that incredibly seriously. It's the reason we did that PHE, or asked for that PHE report that reported at the beginning of the month. My colleague, who's the Equalities Minister, Kemi Badenoch, is now in the process of working with that report to come out with a series of recommendations. But I can give you a sort of early sneak preview. When I say that, we consider it doubly important to make sure that people working in some of those higher risk environments, which coincidentally are, as you described, environments that Black, Asian, minority and ethnic people might be working in, get additional support in terms of testing and tracking and tracing, so that we're providing all of the great NHS track and trace specifically to them. And in practical terms, that means being able to ramp up the amount of testing that people in that environment are getting, as you rightly point out, disproportionately served by people from BAME communities. So that's a very first thing. And probably on the second point, it's probably one for you, Stephen.
Yes, so you're absolutely right. It's key during COVID-19 that we ensure that the NHS does everything it possibly can to ensure that its nurses, but all its all the groups working within the NHS, where they are potentially at higher risk of COVID. And as you know, we have begun to understand the risk factors for that. That includes ethnicity, but it also includes obesity, it includes age, it includes being male, that our individual NHS organisations are able to understand that those individuals need additional support, that we need to risk assess individuals against the work they're doing, and where necessary, redeploy them if that reduces risk. Of course, that's something that can only be done on an individual basis, because individual circumstances are different and individual risks are different. But we have worked with groups outside the NHS to issue guidance, independent expert advice to healthcare organisations as to how they should do that risk assessment and the sorts of things that they may be able to do to support those staff. I think on your second point of ensuring that everybody is working within their scope of practice, within their capabilities, of course that is true across all healthcare professionals, and it is the case that people should be working in areas in which they are competent and feel competent, and local organisations, of course, with others such as Health Education England, are there to make sure that does happen.
Stephen, thank you very much. Gemma, thank you for that. And sorry, did you want to come back in?
I just had one more quick question about student nurses. The new academic year is fast approaching, and student nurses are still not sure what their courses, what shape their courses are going to take from September. When are they going to get clarity around that? And is the government making any contingency plans for the possibility that student nurses might have to extend their courses because they haven't been able to meet, say, the clinical hours required due to the pandemic, and therefore not as many nurses are going to be qualifying at the end of the year as we expected?
Gemma, thanks. Stephen, do you know?
Well, I think one of the things that is generally true as a result of COVID, and I think this is education, higher education in general, which would include nurses but other professional groups, is that universities, institutes that do that teaching are having to rethink the way they deliver teaching. And you're seeing that in universities in general, and I think you will see that in individual courses. And I know Health Education England, who have responsibilities in this area, are working very closely with the providers who provide training to student nurses to think how we can most effectively deliver that training in a COVID environment where it will be less possible to do the sort of face-to-face teaching in some part of the courses that we've traditionally done. Now, as it happens, I think many universities, many institutions have been moving in that direction over time and thinking about different ways of teaching. And as with many things, COVID-19 will accelerate that process. But what's important throughout all of this is that high-quality education is in place, and it appropriately prepares people for the workplace.
Gemma, thank you. Stephen, thank you to you. And I want to say thank you to Sir Peter as well. And just to finish off by saying, when I stood here at other times in earlier press conferences, we've been reporting deaths in the many hundreds and infections in the many, many thousands. And we are reaching a point now where those numbers have come down. But it's absolutely essential that we don't throw this away. It's going to be another warm weekend. It's very, very important that people continue to follow this advice. We do not want to be going backwards or facing a second spike. And of course, critically, from Monday, if you're travelling on public transport, which once again we ask you to avoid, but please remember face coverings are mandatory in England from Monday. Thank you very much.